Welcome to In Your Neighborhood. I'm your host, Chris O'Rourke, as we continue our series, Conversations on COVID-19. And one of the issues that many parents like myself are dealing with these days is having the kids at home. Having kids in general during a crisis like this can be a little trying. So we are joined today by Dr. Monika Parikh from Geisinger Medical Center. She is a pediatric psychologist. Welcome, Dr. Parikh.
Thank you for having me today, Chris.
So, Dr. Parikh, if you could real quick, just run me through your background.
So I currently work as a pediatric psychologist. I'm embedded in one of our pediatric primary care clinics at Geisinger. And so within our health system, we have 10 different sites where psychologists are embedded and working very closely with our pediatricians and providing behavioral health and mental health services very closely to our patients and our providers.
Okay, well, say right from the start that Dr. Parikh has some bandwidth issues, so that's why her video is a little glitchy, but her audio is good, so we'll just proceed ahead in that respect. So real quick, Dr. Parikh, what was your reaction when the situation started to head south back in early March?
Yeah, I think like many people, I was initially surprised and maybe even confused about what I was seeing on social media, what was being depicted on the news. And as things started to get worse, I began really feeling worried about how would this impact me as well as my family. Specifically, I was worried and sad about having to limit my social interactions with my local friends and having to cancel family trips and outings, and also postponing other life events that my husband and I were looking forward to. However, the most important thing that I was concerned about was the health and well-being of several members of my family who are healthcare providers. And really I was worried about whether they would, what their potential for exposure to COVID would be while they were continuing to provide care for their patients.
And you are working from home now as opposed to going into the office on a daily basis?
That is correct.
So would that be the main way that this has changed the way you deal with patients and their parents?
Well, that is one of the main ways that the work I'm doing has changed. In about mid-March, our department converted all of our psychology appointments from face-to-face visits to telehealth appointments, so we could continue providing behavioral health care services to our patients virtually from our homes. So this now involves me conducting therapy sessions with my patients via telephone or through a video visit. And as you would expect, not only has this impacted where I'm providing the services and how I'm providing those services, many of the conversations I'm having with patients are surrounding the patient and the family's adjustment to and coping to the changes in their lives in response to COVID-19.
So what are some of those changes they're experiencing and how they're dealing with it? What are the emotions they're dealing with right now, and that you're dealing with, that you're seeing?
Yeah, I would say there's some variability in what patients and families are experiencing. Some of our youth are struggling and having difficulty with coping with limits to their social interactions with their friends, as well as some kids and teenagers are experiencing increased anxiety as their parents continue to go to work and provide care for patients within the Geisinger health system or other health systems across central Pennsylvania. And also, I think parents are having difficulty with adjusting to being at home full-time with their parents. And so that comes with unique challenges for everyone.
So 2 months in, should kids still be struggling with this, even asking questions at this point?
Yeah, that's a great question. I do think that it's not uncommon that children and teenagers are continuing to have some difficulty with these unexpected changes in their lives in response to COVID-19. If you think about it, initially in March, the changes were temporary, right? So the return to school activities were postponed. However, as things started to get worse over the past month, those changes became more permanent. So schools fully transitioned to online learning for the remainder of the academic year. Almost all school and extracurricular activities were canceled. And so prior to March, or around mid-March, our youth was, they had this possibility. Maybe I might be able to get to see my friends. It's possible that I might be able to go back to my typical activities. And then when things were officially canceled, they, in my opinion, they may have gone through a second wave of adjustment, right? But this time, there's no clear timeline of when things are going to go back to what life was like pre-COVID, with no restrictions. And so I think it's not uncommon, and it's very understandable given this uncertainty and this change kind of in a short period of time, that our youth and our children and teenagers are continuing to have some difficulty, but also question, hey, what does this mean? How is this going to impact what I'm going to do? What is this going to be like in the summer? Am I going to have to cancel my summer plans? For those students who are going to college, they might be thinking, how's this going to impact me next year? And so I do think that one of the things I have learned in this whole process is this is an ongoing transition that we will all be facing for the next several months.
How much has it helped some of these children to have their parents home with them during this time?
Yeah, I think there's some variability in that, given the shelter-at-home order and recommendations for us as individuals to have social or physical distancing, families are spending a lot more time together, and they're having to learn how to adjust to this, what I call the new normal, but really without much preparation. So for some families, my experience in my conversations with them has been resulting in maybe a little bit more stress and tension, especially as parents are navigating working from home while their kids are at home full time. And for many of those families, they relied on social supports or grandparents to help out with taking care of their children throughout the day. And that isn't something that is available to families right now. And also, one of the biggest conversations that I've had with families and parents, and this is not surprising at all, is as their children are transitioning to online learning, parents are faced with the challenge of stepping into the role of being a teacher, which can result in some high frustration and stress between parents and children, especially if they don't understand the content or the material. And also, I think with teenagers, I would assume that many parents and teenagers are having common disagreements related to the limits that are being set about them being able to go see their friends. And I think at school, these kids were able to see their friends whenever they wanted without too many restrictions. And so there, lots of adults and parents are having to put some restrictions on the frequency of their kids being able to spend time with their friends. And then on the other hand, there's probably a handful of kids that are absolutely adjusting really well and loving having more quality time with their parents or with their family. They're learning new things. Maybe they're taking on new hobbies. And many kids I've talked to have said they're really enjoying having more free time to be able to do things they want to do.
So should the response of children, or does the response of children, the response of children differ according to age, from like maybe like a 5-year-old to an 8-year-old, 18-year-old?
Yes, absolutely. There are likely differences in how the reactions of younger children compared to teenagers. And this is likely affected by their developmental understanding of what's going on right now and around them, as well as how COVID-19 has had a direct impact on their day-to-day activities. So what I know is younger children tend to look to their parents or adults in their life to decide, hey, how should I respond or react to these difficult situations that are happening around me? And or should I be concerned? So really the adults in these kids' lives help young children decide how to respond to these changes and adjustments that they're making. And so what I've been telling parents is that as a result, it's very important that parents stay calm and composed when they're managing their own emotional reactions to the uncertain times that we have ahead of us. And in my experience with working with families, overall, some children have been adjusting pretty okay to these recent changes without too much difficulty, whereas other children may be displaying more disruptive behaviors as a result of being cooped up in their house, or may not quite understand why they can't see their grandparents or other loved ones that they used to see frequently and that they could embrace regularly. And then we have our teenagers who have a completely different, I would say, experience with how they're adjusting to what's going on around us right now. Many teenagers right now are having a lot of difficulty with not being able to see their friends and feeling like they're being stuck at home or they're stuck at home. And this may contribute to feelings of social isolation or a lack of social connectedness, and maybe even some sadness. And so I know in many conversations I've had with patients, this has been particularly challenging for our graduating seniors who are missing out on a lot of their senior activities that they've been looking forward to since they started high school. And also, they aren't getting the opportunity, or they're worried about not getting the opportunity to be able to connect with their friends before they go to school. So one of the things that I have really been talking to families about, but also teenagers, is during this time, and as teenagers and families are adjusting to having limited contact with people they love, I really am encouraging teenagers to find creative and alternative ways to stay connected to their friends. And so they don't continue to feel isolated or sad about having limited interactions.
What can parents do to help them?
Yeah, I think that is, these are common conversations that I have with parents. You know, I strongly encourage parents to tell their kids, you know, try to connect with your friends via FaceTime or some kind of video connections, right? Contact your friends more regularly. One of the biggest challenges that I've had when suggesting that is teenagers have really been saying, but I don't want to do that. I just want to see my friends in person. And so I think parents can, as nicely and kindly as they can, guide their children and teenagers to connect with their peers in these alternative ways, and really having conversations about what this might look like soon as the shelter at home orders start to get lifted.
So I'm asking this for a friend. What can parents do to help themselves deal with the stress of suddenly being around their children all the time, and also not only working from home, but teaching from home as well, something they never even thought about?
Absolutely. I think one very important thing that I have been emphasizing and also implementing in my own life is making sure that I take a break and take care of myself and do things for myself. And this is good for kids and teenagers to have some alone time. And so strongly encouraging that when you're creating a sense of structure or daily routine to your lives, that also involves folding in, if possible, alone time. So for parents of young children, if possible, when your children are taking naps, if they still take naps, do things that you enjoy doing. Read a book, just sit outside, talk to a friend, connect with someone. And also encouraging our children and teenagers to do the same, because this is a lot of time spent with one another, and this is not how we typically tend to spend our lives with the people in our homes.
Okay, schooling. Kids aren't going to school anymore. So their schools have set up online learning for them, and they do all that work. I've seen some people who've said, just let the kids be kids during this time. Don't really push the schoolwork. Do you agree with that, or do you think there's a balance there?
Yeah, I think, Chris, you're bringing up something that is a common conversation that I have had with the majority of the families that I'm working with, especially as the whole family is transitioning to their children going to online learning. And so I think there has to be a balance. I think you hit the nail on the head on that one. You know, I have been telling families, although your children aren't currently attending school in the traditional way that we typically have children learn, we want to also make sure that we're incorporating some type of educational learning throughout the day. And part of this is also making sure that we are maintaining a sense of normalcy to help all of us transition to our lives post COVID-19, because that will come. It may not seem like it's coming, but it will come, and we want to have a sense of normalcy, and that involves making sure that our students and our children and our teenagers understand that when August resumes, they will be going back to school, even though they've been out of school for several months. And so I've been recommending that parents kind of incorporate a sense of structure or a daily routine that builds in some time allotted for educational time, allotting time for them to be able to socially connect with their friends, not all day, but a portion of their time where they can socially connect with their friends, making sure that teenagers and children are having the opportunity to be on electronics, right? Making sure they're folding that in as well. And most importantly, making sure that they are encouraging their children to go outside and exercise and be physically active, because it's very easy when you are in the house with each other 100% of the time with no relief, that may increase tension and stress.
Okay, so we're, excuse me, in an area that is moving to yellow on Friday, tomorrow.
Yeah.
How do we help our kids as we begin to lift restrictions and move towards this new normal?
Absolutely. I think that is likely going to be the conversations that I have with many of the families I'm working with, especially this week. And so I have been thinking about this a lot. And I know as a social being, we are all eager, right, to get back to quote unquote normal social activities. However, I would recommend that families really follow the guidance and recommendations of our local communities and counties, the state officials, as well as the CDC, to ensure that they are aware of what activities are safe and whether social gatherings and the amount of people in those social gatherings are even allowed. And so specifically, I recommend that families have discussions with their children where they're clearly outlining what the rules and expectations are for their children's social interactions as these shelter-at-home orders are gradually lifted. Now, many teenagers may not like this, but parents may want to initially start with setting some sense of some type of limits, right, to those interactions. So including how frequently they're seeing their friends, where they're seeing their friends, how long they're allowed to be out with their friends, and also how many kids are allowed to be in this small place together at one time. And I know that can be really challenging for our teenagers to hear, because they're ready to go back to pre-COVID social interactions. And so I would also add, in those conversations, parents should be reminding their children of the importance of physical distancing and maintaining the appropriate physical distance, not only to protect themselves, but to protect the people around them, especially if, many families may have people that they live in their home that are at greater risk of getting ill. And so it's really important that they're maintaining this appropriate physical distancing as they're kind of resuming to social interactions. And in addition to physical distancing, it's important that we remind and encourage our teenagers and children to continue to engage in those safety precautions that are put in place when and while they are out. So making sure they're washing their hands when they return home, making sure they're limiting how much they touch their face, covering their mouths or when they're coughing, making sure they're not embracing and hugging one another immediately, because right now we're slowly, we don't know what this is going to do, and if this is going to help us continue to flatten the curve or result in an increase in the pandemic.
Or even wearing a mask. I imagine even for teenagers, maybe a little bit more for them than younger kids, it might be harder for parents to get them to wear a mask if they're out there by themselves, or at least keep wearing it. They'll wear it when they leave the house, take it off when they leave. How do they How do they get that message clear to the teenagers and even younger kids that in the future, when they leave the house, they're going to need that mask on?
Yeah, I think that's a hard one, because unless the parents are there with the teenagers, monitoring their social interactions, it's going to be very hard for them to police or monitor whether their teenagers are continuing to keep the mask on. What they do have in their control is to remind their teenager that it's very important that they do wear their mask. And if they happen to walk by the park that their kids said they're going, and they witness their teenager not having a mask on, making sure they're kindly and gently, right, reminding their teenager, maybe via text message, hey buddy, saw that you don't have your mask on right now. It's important that you wear your mask, or we're going to have to set some limits about your ability to spend time with your friends. I think that younger children may have some initial hesitation or nervousness about masks. And so what I think is very important is that parents kind of initially provide a very brief is the key word, an age appropriate explanation to their young children, but also their teenagers, of why it's important to wear a mask, right? And answer any of their questions that they have, while also trying to find creative ways to increase their children's comfort with wearing the mask. And so a couple of suggestions that I can think of is that, if possible, if parents and families have not made masks yet, or are planning on buying them or making them, maybe have their child pick out the pattern, right, or the fabric that they want to use for their mask. And if possible, obviously maintaining appropriate safety precautions, include their child and teenager in making those masks. It might increase their motivation or interest in wearing the mask. Also, I think one thing that we have to do as we're building any habit in any human, right, including adults, I've had to really practice in wearing the mask, trying it on. We need to also do the same for our children, is really helping them get used to wearing it. And that can be done in lots of different ways. That can be done with parents showing their child how to put it on and off, not when they need to go, but just at home, and also role modeling that same thing. Or have them practice wearing the mask before they have to go outside. Because the last thing we would want is where you are about to go somewhere, you've been looking forward to this social interaction for a very long time, and your child throws a big tantrum because they do not want to wear the mask, because this is the very first time, right? They've been exposed to this contraption that's going to go on their face. And so really encouraging parents to help their child get used to it. And I've talked about the idea of maybe sprinkling in small rewards, right? And tons of praise for their children practicing wearing the masks, and then also successfully wearing the mask when they're out. And so making sure that parents are rewarding these behaviors as they're trying to help build habit up in their children. And then, of course, making sure we as adults are doing a good job role modeling health behaviors and wearing a mask, when we leave the house, and really communicating that this is an important thing that we are going to do to keep ourselves safe, but also to keep the people we care safe.
You brought up one real quick thing that I want to touch on. When talking about this with young children, how honest should a parent be with them?
Yeah, I think that that there's some variability in what people would say is helpful or unhelpful, right? So what I really encourage parents to do is to have a balance, right? A very clear balance of the conversations they're having. And so these conversations should have a balance of sharing important age-appropriate facts, right, with their child that they would like their child to know based on their family system, as well as making sure that they're correcting any misinformation that their child has without further contributing to anxiety, right? That's a very big ask that we're having parents do. And so one of the things is having an open, honest, accurate conversation about COVID-19 is more likely going to help our children understand what's going on around them, and also even reduce some of the fears and worries that they have about this uncertainty or this unknown. And then and also encourage them to start to feel more safe, given everything that's going on around them.
Okay, we asked you about your reaction at the beginning of the segment. So we've been ending our segments by asking the people we're interviewing how they're handling this situation personally. So how you been doing since that initial reaction?
Yeah, I would say I still on a regular basis continue to be concerned about my family members who are, providing care to patients here locally, but also in the state of Texas. And so I do regularly check in with them, and that has helped me see how they're doing, as well as making sure if I'm having a hard time, talking to the people that care about me, that surround me, and also the people that I love, and just sharing my feelings about that. And then making sure that my husband and I are taking very clear safety precautions to ensure our own safety, but also the safety of the people around us. And so that's kind of the initial concern that I had, is how am I going to cope with people I love being at risk. Kind of on a personal regard, I have had to make sure that I'm following the recommendations that I'm giving the families that I work with. And so I have really worked hard to have a sense of routine in my daily schedule before and after starting to work. And so that might include exercising, or after work going on a walk and getting some fresh air, especially if it's beautiful out. I am also making sure I incorporate educational activities, reading books, doing crossword puzzles, and word searches. And I absolutely love doing puzzles. And so I have found that I am carving out far more time now, as I'm transitioning to being home more, to doing lots of puzzles. And, as I mentioned, one thing that I was concerned about as well was about how am I going to stay connected to the people I care about. And so I have been making sure that I'm intentionally finding ways to connect with my friends and my family. So I probably once a day call at least somebody in my family to have a conversation or FaceTime. And then in large groups, we have done some Zoom video sessions, which are always a really fun time to have 20 people trying to talk all at one time. But those are the ways that I've kind of helped cope with these changes, but also stay connected to people that I care about and hold very close to my heart.
Dr. Monika Parikh, a pediatric psychologist at Geisinger. Thank you very much for your time today and your insight. Very informative.
You're welcome. Thanks for having me, Chris.
And we will be right back.